The pandemic has had a significant impact on road safety in Australia, affecting various factors such as traffic volume, speed, driver behavior, enforcement, etc. In this section, we will explore how these factors have changed during the pandemic and what implications they have for reducing road trauma. One of the most noticeable effects of the pandemic was the reduction in traffic volume due to lockdowns, travel restrictions, and increased working from home. According to the National Road Safety Strategy 2021-30, traffic volume decreased by 18% nationally in 2020 compared to 2019. This reduction was more pronounced in urban areas than in rural areas, and more evident for public transport than for private vehicles. The decrease in traffic volume was expected to result in fewer crashes and fatalities, as less exposure to risk means less potential for harm. However, the actual impact of the pandemic on road fatalities was not as straightforward as expected. Based on provisional data, Australia recorded 1,094 road fatalities in 2020, representing a 7.8% decrease compared to 2019. While this is a welcome improvement, it is far from the target of at least 30% reduction in fatalities and serious injuries that was set under the National Road Safety Strategy 2011-2020. Moreover, the decrease in fatalities was not consistent across jurisdictions or road user groups. Queensland was the only state or territory to record more road fatalities in 2020 than in 2019, with a 26% increase. Pedestrians and cyclists also saw an increase in fatalities by 16% and 44% respectively. These figures suggest that other factors besides traffic volume may have influenced road safety outcomes during the pandemic. One of these factors is speed. The reduction in traffic volume may have created more opportunities for drivers to speed, as they perceived less congestion and less enforcement on the roads. Speeding is a major contributor to road crashes and severity of injuries, as it reduces the time and distance available for drivers to react and avoid collisions, and increases the kinetic energy involved in a crash. According to the National Road Safety Strategy 2021-30, speed-related fatalities increased by 7% nationally in 2020 compared to 2019. This increase was especially evident in rural areas, where speed limits are higher and roads are less forgiving of errors. Speeding also poses a greater risk for vulnerable road users such as pedestrians and cyclists, who have less protection and visibility than vehicle occupants. Another factor that may have affected road safety during the pandemic is driver behavior. The pandemic may have caused stress, anxiety, fatigue, and distraction among drivers, affecting their ability to focus and make safe decisions on the road. The pandemic may have also changed the patterns and purposes of travel for some drivers, exposing them to different types of roads and risks that they were not familiar with or prepared for. For example, some drivers may have switched from public transport to private vehicles or from urban roads to rural roads due to health concerns or travel restrictions. These changes may have increased their exposure to risk or reduced their awareness of hazards. A final factor that may have influenced road safety during the pandemic is enforcement. The enforcement of road rules is essential for deterring unsafe behaviors and ensuring compliance with speed limits, seatbelt use, drink driving laws, and other regulations that aim to protect road users. However, the pandemic may have affected the availability and capacity of police and other authorities to enforce road rules effectively. The pandemic may have also created challenges for communication and education campaigns that promote road safety awareness and behavior change among drivers and other road users. In summary, the pandemic has had a complex and varied impact on road safety in Australia, affecting factors such as traffic volume, speed, driver behavior, and enforcement. While some of these factors may have reduced road trauma by decreasing exposure to risk, others may have increased it by increasing risk-taking or reducing safety margins. The net effect of these factors may vary depending on the jurisdiction, road type, and road user group involved. Therefore, it is important to monitor and evaluate the changes in road safety during and after the pandemic, and to implement appropriate measures to address the emerging challenges and opportunities for improving road safety outcomes. What are some effective strategies and actions to prevent and reduce road deaths in Australia, such as education, engineering, enforcement, emergency response, etc.? Australia has a 10-year plan to improve safety on its roads and reduce road trauma by at least 50% for fatalities and 30% for serious injuries by 2030. The plan is based on a social model approach that aims to foster a road safety culture across society and make road safety business as usual. The plan also adopts the goal of zero deaths and serious injuries by 2050, Vision Zero. Some of the key priorities for action under the plan are improving the safety of roads and roadsides by applying the safe system principles and standards, prioritizing high-risk locations and corridors, and investing in infrastructure that protects all road users, especially vulnerable ones such as pedestrians, cyclists, and motorcyclists. Enhancing the safety of vehicles by encouraging the uptake of safer vehicles with advanced technologies and features, implementing minimum safety standards for new and used vehicles, and supporting the transition to low and zero-emission vehicles. Supporting safe road use by strengthening road rules and regulations, enhancing enforcement and compliance, promoting safe behaviors and attitudes, and addressing the factors that impair or influence road user performance, such as fatigue, distraction, speed, alcohol, and drugs. Strengthening post-crash care by improving the availability and quality of emergency medical services, trauma care and rehabilitation, supporting victims and their families, and enhancing data collection and analysis to inform road safety interventions. These actions require strong collaboration and coordination among all levels of government, industry, academia, civil society, and the public. They also require adequate funding, monitoring, evaluation, and reporting to ensure accountability and effectiveness. By working together, we can make Australia's roads safer for everyone.